Hi, I'm sure you remember me, right? I'm Marley. Today I'm going to be doing a gaming video today. Today I am playing Surgery Squad. This one's kind of a little different. I've tried many times to read it and pronounce it until one day I finally got it right. It's called Rietnal Detachment Eye Surgery. And as you can see here, that's one big red eye. So, what do you say we get started, huh? Let's play.
Hello, and welcome to Surgery Squad's Retinal Detachment Surgery. I'm Dr. Jeff, and I will be guiding you through this procedure today.
You must be the Jeff guy my friends were talking about.
The retina is located in the back of your eye. When we see, light enters the eye. It is focused onto the retina, which acts like the film in a camera, feeding information to the optic nerve, allowing you to see. As you get older, the vitreal fluid, which is the gel in your eye, can contract, pulling the retina away from the eye. This contraction can cause a small tear in the retina, allowing the fluid to seep behind the retina, detaching it from the back of the eye. This can cause loss of vision. A retinal detachment is a very serious ailment that must be dealt with as soon as possible after discovery. Symptoms that you may experience with a detached retina include seeing floaters or frequent flashes of light, shadows appearing in your peripheral or side vision, a gray curtain moving across your field of vision, or a sudden decrease in your vision. Again, if you experience any of these symptoms, contact your eye doctor immediately. Today, we're going to perform a retinal reattachment called a pneumatic retinopesty.
His eyes.
The surgery takes about an hour and can be done on an outpatient basis.
Why is it red? Doesn't make sense.
Our patient today is a 30-year-old man who recently noticed flashes in his vision.
And one thing
His
I noticed in these
ophthalmologist
games is that they don't say the patient's names,
detected a retinal tear
like they
and
do
a
in
detachment.
Operate Now.
He recommended
You know what I mean?
immediate surgery to limit additional loss of vision. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put him to sleep. Can you place the needle for me?
Oh, this is gonna make my stomach squeeze. What about you guys, huh? Ugh. Ugh. Sorry if I'm shaking a bit.
Just prior to surgery, additional drops of anesthetic are applied.
Oh, are you gonna drop into the other eye too? Or just the one eye?
We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please.
Okay. Oh my god, that's one big eye.
Now that the patient is anesthetized, we insert a syringe into the eye.
Can't tell me that the lady that he played from that other game with the LASIK? Yeah, remember the lesson that he told her not to shine lasers in your eyes unless if it's LASIK? Yeah, that's what I'm talking about. That lady's eyes were a lot smaller than that.
Now we inject an air bubble into the vitreal fluid.
Air bubble? Huh? That doesn't make any sense.
As the bubble expands, it pushes the retina back against the wall of the eye.
You know, at this point, some of these surgeries are kind of complicated.
With the retina back in place, we can now seal the tear using a freezing probe. The probe is touched to the outside of the eye where the tear is. This freezes the tear back in place.
So complicated?
It may take several touches depending on the size of the tear.
And a little less understandable. Because how do doctors know about these types of things? You know, I'm sure you might get a full experience on doctors if you ever played the game Trauma Team. Trauma Team, you know that Wii game about those doctors? It's rated T for teenagers. 6 doctors. One has no name, but he was called CRS-01. That's his prison number, but if you look at a Japanese book or on the wiki website, his name is Erhard Miller. Anyway, let's refill in the tear.
The tear is now repaired. The needle insertion will heal quickly. Can you remove the speculum?
I didn't think this surgery would take that long. How would this take 2 hours if it goes that quick?
Our patient needs someone to drive him home after the surgery, and he shouldn't drive until he regains sight in the eye. We'll prescribe medicated eye drops to use several times each day for a few weeks after the surgery. And he'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses also need to be worn to protect his eye from sunlight and other bright light as his eye recovers. However, the biggest part of the recovery is head positioning. The bubble floats to the top of the eye, so the head must be positioned to keep the bubble against the detached portion of the eye. This means the patient must keep his head facing down, or the position indicated by his surgeon, for at least a week. Sight returns slowly to the eye over several months as the bubble must dissolve and be replaced by vitreal fluid. However, once the bubble dissolves, vision is usually restored to close to the previous level.
I'm going to need to have a talk with you guys.
You did a great job
once
today,
this
surgeon.
Game is
While
done.
You're here, try one of our other surgeries here at surgerysquad.com.
Well, now that's done. I just want to say, you have to keep your head down like this. Doesn't that feel weird for a week? Wouldn't that hurt your neck? If you just kept your face down for a week? Or whatever position? I think I'm going to need an expert to answer those questions. But until then, see you later, guys. Don't forget to like, subscribe, and turn on post notifications.